just kind of being confined to the box of corporate nursing was, frustrating at times.
I love the education piece of nursing, and getting my master's allowed me to do so much more detailed research.
It wasn't right away. It was one person that kind of had a word of mouth, so it kind of spread a little slowly at the beginning.
Paycheck, a pension, I'm like, is this the right thing? But looking back, it was the best day of my life.
Looking for real stories of real people making a difference in the Grand Canyon State? Welcome to Finding Arizona podcast. We sit down with Arizona's inspiring entrepreneurs, creatives, and community leaders and give you a front row seat to their journeys, passions, and projects. Whether you're a local trying to find a hidden gem or just enjoy watching someone chase their dreams, Finding Arizona is your go-to place for authentic conversations with a desert twist. New episodes drop weekly, so hit subscribe and start exploring Arizona one story at a time. Welcome back, everybody, to the Finding Arizona podcast. I'm your host, Jose, and as always, we bring in fantastic guests every week. Today is no different. Ladies and gentlemen, I would love to introduce both of my guests, but I'm going to do an intro because here's something most of us don't think about until we're living it. The hospital is only half the battle. What happens when you get home, when the nurses aren't there, when the questions start, and when something doesn't feel right? That's where so many patients fall through the cracks, and today's guest saw the gap up close, decided it was unacceptable, and built something to close it. Kendall Dorr and Katie Shurkamp are registered nurses and the co-founders of the Recovery Practice, a Scottsdale-based concierge nursing service that delivers expert, personalized post-operative care directly to patients' homes throughout the valley. No waiting rooms, no rushed appointments, just real dedicated nursing care from people who genuinely know what they're doing in the place where recovery actually happens at the home. They left the comfort of an established careers, bet on themselves, and built a practice they knew patients deserve. Kendall brings her background as an oncology certified nurse, a credential that reflects a deep commitment to complex, compassionate patient care. Katie brings her master's level clinical expertise and a passion for making that care genuinely accessible. And here's what I love most about their mission. The Recovery Practice isn't just for those who can easily afford concierge care. They are deeply committed to serving underserved families. Man, I'm going to get this right. Making sure that the financial barriers don't stand between a patient and the expert support they need. So this story is about two nurses who refused to accept a broken system and built a better one from scratch right here in Arizona. Kendall, Katie, welcome to Finding Arizona podcast.
Thank you.
Thank you.
Of course. To be here.
And it's incredible that I have you both here. And I'm going to just start with the question that we typically ask everyone is give us that moment where, again, you both have different origin stories. So I want to break this apart in the sense of like, let's get individual backgrounds first and just kind of go from the point that you guys kind of met and had an aha moment. So we'll start left to right and then go from there. So go right ahead.
Okay. So my origin story is I've been a nurse for over 10 years, over a decade. I started in inpatient oncology at the hospital, and then transitioned to concierge medicine, where I spent the last half of my career. And Katie and I have worked together in both of those departments. Yes. So in our concierge department, we dealt with a lot of executive, high-profile patients. And we saw over and over again that when those patients had surgery, they had to come home. It was like everything went out the window. They had the most amazing surgical teams, but they just weren't sure even how to manage their pain, their wounds, or anything. So they would call us. We were the first point of contact as the concierge nurse. And we just wanted to build something where, those patients, the patients that we loved taking care of, we could go into their home and then deliver that care for them.
Okay.
I moved from Colorado to Arizona to go to ASU for nursing school.
Okay.
I graduated in 2020, right when COVID hit. So it was a tough time.
Perfect time.
Tough time to be a nurse there. I started in orthopedics and did post-op surgery there. And then I transitioned to the hospital with Kendall in oncology. She was actually my preceptor. So
explain that. So I want to know the relationship when you guys first started out.
I came to the hospital, worked in oncology, and I had her and another nurse that were my preceptors. So
okay.
I always give Kendall all the credit because she raised me from a baby nurse. Now here we are.
That's so sweet. I love that.
So I started in oncology with her, and then she transitioned to outpatient to concierge medicine, and then I followed after her about a year or so after. And we just always felt, kind of confined to the box of corporate nursing. And so I think we, day in, day out, just told each other, what could we do as something different? So we decided to start the recovery practice and try and advocate for better care and more personalized care for these patients.
I love that. I love that you guys have this kind of connection from the very get-go of like, well, it's a teacher-student basis, but again, it goes further than that. I mean, as you evolve and grow and kind of expand your horizons, there will be those who moths to a flame, so to speak. And it's just, again, it's incredible that you share that light and you're kind of expanding and helping others kind of grow and evolve themselves. So it's really incredible that you're both here kind of sharing this coalescence of what you guys are working on together. So now I will kind of transition, and this is decision to leave and just leaving your kind of, what you guys were doing. You guys were over at the Mayo Clinic. So just again, I'm kind of curious, like, what did you see that wasn't working, and what made you what was like the breaking point for you and the aha moment of like, well, I can go into more concierge work?
Yeah, well, we came from the concierge department, and what that meant is we were a nurse supporting a physician for 300 patients for each panel, and we loved what we did, but there was something missing. Mayo doesn't offer a home care service for those patients, and that was something that we wanted to create. And again, like Katie said, just kind of being confined to the box of corporate nursing was frustrating at times. It's very policy and procedure, and sometimes the patients need more care than what the time card allows.
Yeah.
So, us creating this practice, we were able to develop packages where we're with that patient as long as they need us.
Yeah.
And, we're not going to leave them just because we have to clock out. So the patient feels secure, and, we're doing basically what we love. I think, kind of the breaking point is everything with AI is kind of moving that way. You kind of have to hop on the train or get out of the way. And for us, we wanted to be nurses that are taking care of patients one-on-one. We're speaking to patients, we're responding to patients. It's doing what we do best and making sure that the patient gets that personalized care.
Yeah. Is there anything that you could add or, add on to the kind of foundational like belief of what you guys have going on with your practice?
Yeah, I mean, going off what Kendall said, you cared for this panel of patients so much, and you got really close to these patients. And when they would ask you, I really feel like our patients are truly our motivators in this, because there are so many times you're on the phone and it's, Katie, can I take you home? Kendall, I need you at home. And so I think we just decided, why don't we do this? And then we can be that resource for these patients. So I'm really grateful for, them almost giving us the idea in a sense as well.
I kind of want to know from your own perspectives of like, was there a story or kind of a moment where you're just like, you're doing it, but you realize, this is where I was meant to be? Like, was there a patient or someone, like, again, I go back to those stories, like those patients asking you to come home with them. And like, I can't imagine someone saying like, you've done so much and did such a great job. Please continue it like regularly with me or something like that. It's like, or even in the sense of like being in the work and helping them recover, like that moment of like, true thankful bliss of like, I feel at peace being, at home or something like that.
Mm-hmm.
I think, just in our department, we would have nurse visits. So a lot of those patients kind of used it as a way to come in and just get a second set of eyes.
Yeah.
And I think my aha moment was a patient that had a facelift and was panicked that something was wrong.
Yeah.
And she was only 2 days post-op. She couldn't get a hold of her plastic surgeon. They're busy, they're in the OR. And so the first step for us is to bring them in for a nurse visit. It's a wound, we can assess it, escalate it to the physician if needed. And, she came in and everything looked normal. And it was just kind of talking to the patient that she was like, it actually doesn't even hurt. Maybe I just needed to come in and talk to you. And, the physician came in, everything was great. And that's kind of how it goes, is that sometimes the patients just need that reassurance. When you develop a relationship with somebody, you can calm them down or, recognize if something's wrong. If they're panicked and they're not normally like a panicker, then, maybe we need to take a second look or, whatever. So I think that was a story that, when we had this idea that we work side by side, 40 hours a week. So it's like when you're with somebody, you're always kind of tossing around ideas. So Katie and I, started developing it a couple years ago, seriously about a year ago.
Yeah.
And, we would share these stories and be like, this is why they need the recovery practice, like they can just call us or, whatever it is.
I love that.
But I guess that would be my moment. What about you?
Yeah. I don't know that there was really a specific moment. I think it was just several small things like can I take you home, or just recognizing how stressful these situations are for these patients and just feeling, I think, just so confined by policies at a corporate facility to where, you want to go above and beyond for these patients, but yet you're kind of tied to what you can and can't do, making recommendations and seeing what else they need. You're always tied back to the policy of what you can only go so far for these people. I had an older patient, and it's not really related to post-op, but they're in their 90s. It's hard for them to get around or to get to an appointment and things. And they just want, their B12 shot done at home.
Yeah.
So it's just the simple thing of, what can we do to make their lives easier? Mm-hmm. And I think just having our own practice now, we're open to, whatever each patient needs. And it's truly anything that they need, we can cater to now.
I go and ask these questions because, again, I'm kind of getting to, I love the beginning of the story. I love even the origin stories of there's influence coming from somewhere. And I love that, again, this student-teacher dynamic that has evolved into co-ownership. It's, again, incredible. But again, individually, you guys have your separate origin stories of that and what kind of keeps you motivated and kind of vital to this practice together. But for me, it's just it's like seeing the roots of the tree. I love it because it goes a long way from the standpoint of being the customer. Mm-hmm. For me, I've always felt more inclined if I know a little bit about the owner, or, know about why they do what they do, I'm more inclined to buy. I'm more inclined to participate. Yeah. And so it's bringing the walls down. And I really do appreciate you guys sharing just a little bit about how this all works. So I'm going to go, Kendall, your oncology certification speaks to some of the most complex and emotionally demanding patient care that exists. How has that background shaped the way that you approach post-operative recovery, and what does it teach you about the patients that really, what the patients really need beyond the clinical?
Yeah, I think oncology patients, they're immunocompromised, and you really have to pay attention to any subtle changes. It can be life or death for those patients. So that background has really helped me with post-op because I'm always vigilant. I'm always asking questions. I'm never, saying, oh, that's normal, or, the physicians or the surgeons that we work with, we have some that we have their cell phone number.
Great.
And we can just be in touch with them right away. And that's how I always want to operate. That's what oncology taught me, is that you never ignore something. You never say it's normal, because you don't know what's going to turn into. And if I can't be 100% sure, I need to make sure that, I communicate that to somebody that can tell me yes or no, or I can make the executive decision, we're going back to the ER, whatever it is.
Yeah.
So I think that, and just the emotional part, oncology is a huge life event for those patients.
Absolutely.
And it's a very emotional time, and it's caring for the patient and the family. And that's what we do in post-op too.
Yeah.
It's the husband or the wife that's at home that's, not totally sure what's going on. They want to be the best caregiver, so just educating them too with the patient, being in oncology, these patients are learning a whole new language. They were normal yesterday, something's wrong today, and they don't know all the medical jargon, so breaking it down for those patients, is just the same in post-op, making it where they can understand and they can retain the information to make sure, that everything goes as smoothly as possible.
I think in the overall scope of things, like some of the things that we as the patients and the family of the patients, a lot of us don't understand the residual effects. I mean, the long-term effects. I mean, you are talking about certain patients who might have post-traumatic stress from, recovery, or, family members who can't take on that kind of level of like responsibility. Mm-hmm. They just feel kind of overwhelmed by it, whatever it may be. But I've always kind of I fell on the sort of like, you build that confidence through strategic planning and having a professional insight. You build that confidence over the time and success that you have together through those moments of like trying and really diving in and trying to make it work out. So, having an assistant or having someone who's going to help you through those times is definitely like, I'm all for it. That's something that I really do respect and appreciate. So Katie, with your master's level background, you're bringing a deeper clinical framework to how the practice is built and run. How do you think about designing a nursing service that is both clinically rigorous and genuinely human in a way that shows up for the patients at home?
Yeah, so I think I just graduated with my master's in May.
Congratulations.
So fairly new there, but my intention was always to go into education with it. Mm-hmm. So I love the education piece of nursing, and getting my master's allowed me to do so much more detailed research and different things. And so I hope to bring that knowledge to the recovery practice and continue to provide evidence-based care with Kendall. Yeah. And like we talked about earlier, there's just so much to learn in healthcare, and trying to keep up with the newest things. We're talking about, going to the conference, the plastic surgery conference in Toronto, and we're just continually educating ourselves. Yeah. And so I think getting your master's just allows you that little bit more knowledge and research base that maybe someone wouldn't have.
Yeah.
And there's always more to learn in nursing.
Oh, absolutely.
Or science or healthcare, whatever it is. And, we're always looking for conferences or anything that we can just learn, even if it's just a class that day. We've gone to several, and we have more planned. And, that's kind of the exciting part of what we can do now is we have limitless learning opportunities. And eager to learn.
That's good. It's really good, because again, like you were saying, there's so much out there as far as evidence-based research. And this is kind of what you brought up too with the AI and just kind of newer technologies coming out. And so I'm kind of curious from the standpoint of just as practitioners and as you guys are, students of the game, so to speak, what builds your confidence in this kind of new technology development? And I guess from the other standpoint of the coin of like, what are you worried most about for your patients?
I would start with what I'm worried most about for our patients, because it's something that we deal with already, and we've been dealing with, since it's become, very accessible, is just not calling us or calling your doctor and trusting ChatGPT or AI or whatever it is. And waiting too long,
Mhm.
you know, and that's things that we've seen firsthand. And so I think that part worries me. I think the positive part of it is there are platforms like Open Evidence, you know,
Yeah.
that scan, you know, research databases. It's all research-based, evidence-based practice.
Yeah.
And, you know, it's not open to the public, but for nurses or physicians or nurse practitioners, PAs, whatever it may be, who, you know, has a license, they now have access to the most up-to-date information right away.
Yeah.
You know, so instead of digging in the books, or with nurses, it's Lippincott, you know,
Yeah.
any nurse will know that name. And it's, you know, you can just have a question and then it'll bring up Lippincott's procedure for you or
Yeah.
whatever it is. So I guess that's the positive part, but that's not for the patients. I don't,
Yeah.
you know, I worry about technology, AI, you know, the hospitals wanting to put, you know, a microphone on the nurse's badge to kind of
Mhm.
learn how they do things and
Yeah.
how they talk to patients or to help them chart. You
Mm-hmm.
know, I think that there just kind of leaves a lot of room for error. And
Yeah.
I think that this profession is, you know, I'm a huge advocate for.
It's already
keeping it
hard enough for
one-on-one.
you guys,
Yeah.
and it's definitely even more of like micromanaging. You know, again, I've heard this, the sensors and everything, and it goes even a step further. They've kind of almost forced it on the meta team because they want to see how they engineer, and they
Mhm.
wanted to view their keyboards, and they were like, "This is an invasion of privacy, guys." Like we're
Right.
going.
Yeah.
But they push back because it's like, oh, well, you're working on our computers for our business. It shouldn't be an invasion of privacy. You're working.
Right.
And so it's really, it's a daunting thing when you're trying to really allow for a massive amount of data collection and what is presumed to be very personalized, very individualized pieces of data,
Yeah.
the actual person.
Mhm.
So, you know, there are Pandora's box is already open. So it's that sort of thing where it's like, I hate to say it sooner rather than later, but my hope is I've always leaned on the human factor of like empathy, love, and you know, as much as there's that kind of daunting, you know, scary realization of like Big Brother, there's also this kind of beauty and joy when it's like you talk about like research-based evidence and just collecting those. I mean, I've saw a documentary with patients who can't find out what their illness is. And so it's like, again, that data collection, and they're just all trying to research with other abnormal subjects to kind of understand what it may be. Maybe there is a connector piece in there. So I really do I like to find the silver linings in a lot of things.
Yeah,
and then
that's a great point,
There's
you know.
a good and bad to this, of course. But I hope that people, humans, will try their best to lean more on the joyous and positive side. But there are, again, I go into that with hopes and dreams. That's all I go into. Every founder has a moment early in where they look at what they have built and think, this is actually working and this is actually helping people. What was the moment for the recovery practice, but also how did it feel like personally?
Want me to start with that one?
Sure.
Yeah.
I feel like, you know, it wasn't right away. You know, it was one person that kind of had a word of mouth. So it kind of spread a little slowly at the beginning. And that's when we were still working full time too. But I think the moment, you know, when it all clicked is when we just took care of a patient, and you know, she was so grateful and thankful. And, you know, the surgeon was so grateful and thankful that we called him, you know, on the issue that or the complication that came up. And, you know, the care was very timely. You know, there was so much that could have gone wrong, nothing went wrong. It all went well. And then the patient felt, you know, just cared for. And so I think when we got that feedback, you know, it was a very long week. So we kind of decompressed for a couple days after, and we didn't want to reach out to the patient. You know, she had a long week. We didn't want to reach out to the surgeon, but both of them reached out to us, you know, a few days later. And just having that feedback was just like, okay, we're doing this. And, you know, it was shortly thereafter that we left our full-time careers or our careers behind, and we're like, we're going to do this. You know, we're going to build it. So yeah.
I think tagging off what she said, we've worked in concierge medicine for the past 5-6 years, and you are used to working with patients that are CEOs. They're very they have a high net worth, they're elite and very educated people. So I feel like maybe the average person's bar is here, but their bar is way higher. Their expectations far exceed many. And so I think working now for the recovery practice and being able to meet their needs and hearing that, their bar is so high, but we've met or exceeded that bar. I think, like I said previously, our patients are just our motivators in this, and they continue to inspire us to just keep going.
Yeah. And speaking of which, I mean, this is something that I touched upon in my intro. And it kind of touches upon the expectation of care and the inside of the patient itself. So you guys really do commit yourself to serving the underserved families into the core of your mission, making sure financial barriers don't prevent patients from getting quality recovery care. In a concierge model, that's not the obvious path. How are you making that work, and why is it a non-negotiable for both of you?
Yeah, so I think it's non-negotiable because it's really why we got into nursing. How we're making it work is there's a couple surgeons that they do work on the reservation. They will travel there, or they'll actually transport patients, to their practice, and it's for chemotherapy or whatever it may be. And so we've partnered with them and are donating like a portion of our hours every year. So patients that, they need to be home with their family.
Yes.
They prefer that. And Medicare or Medicaid doesn't necessarily cover a nurse to be there 24/7. So their options are usually these facilities that, they're not going to heal in, either mental or emotionally, mentally, whatever it is, even if it's physically, we want them home. We want, those patients should experience this type of care. And, working in oncology, I think we both experienced those moments with patients where it was very rewarding. So when we started building the recovery practice, we reached out to those surgeons and physicians that we know are connected to that type of work and said, how can we help?
Yeah.
So that's something that we're doing. Yeah. And
I think that's incredible. That's a really remarkable way of going about it, because again, you go back to just, again, the inside of like, that these certain patients, these families are just, again, tight on budget, tight on these time, but the best place for them to be, and you can go into research and find whatever it's known. It's like being at home. One, mentally is the best situation, but two, it's like, again, you guys are doing so much, but then it's like you need help too. It's like there needs to be another family member too in that situation. But I go back to fundamentally, emotionally, physically, a comfortability factor of like just being at home and allowing yourself to be there to recover and just feel better. It goes a long way, and not being in a place that's like scary and unknown, and
in
just
your own bed, petting your dog, having your son walk by. It really does help you, recover quickly. So
absolutely. And the thing about that is, I really do. I find it respectable because, again, you guys know. You brought up the reservation. It means a lot to me because, again, I am in that kind of situation. I have to go and I don't have to. I choose to go through the route of the Indian healthcare because, one, I've been doing it since I was a little boy. And so that's all I've ever really known. Yeah. Two, I just think it's in a situation where all of my records are, it's just a better overall sense of like the overall health of me. But I know I will need supplement work or outpatient care and stuff like that. So that's, to me, where I can see people out in the real world doing what they can to help support those who need it most. I'm so happy that you guys shared even just a little bit of your time, because that means I'm taking away from someone out there who's like needs it just as much. So I really do respect that, what you guys are going through. I'm kind of curious right now, just because we're talking to each other. I mean, when you first left your practice, what was that conversation like with your husband and your family? And then same thing with you. It's like, you know, you're from an out of state. It's like, what did your family think? Because I'm saying this, I work with my significant other. I do have a family, and it's a scary thing when you walk away from a paycheck like that. And I can imagine for yourself, it can be very much, you went a little bit slower, but it's this anchor. It's this thing that's supporting you and your loved ones. So I would love to get your insight.
Yeah. I feel so blessed and lucky that my husband and both of my daughters have always been incredibly supportive. Like they see what Katie and I are doing. You know, we were doing our jobs 40 hours a week and then building our website. Like literally we did everything ourselves to save $1 or a penny, knowing that we would possibly take that leap. So those conversations came early, and it eventually became, you know, where we were so passionate about what we were doing outside of that 9 to 5 that, you know, my husband was like, it's time, you know, you need to start thinking about it. And, you know, when you work in concierge, as long as we did, you develop these deep relationships with these people. It's the same people for 6 years that you're talking to every day. You know everything about them outside of their healthcare, whatever they share. You know, so that was the hardest part for both of us, is, you know, kind of making that decision. But I think for my husband, he was always very supportive. We kind of put things in place, you know, that we would be okay financially, you know, left the retirement, left the pension. That's still scary, you know, but Katie and I think he has full confidence that we're going to be just fine. You know, we're not giving up. And you probably know, doing your own thing, it's just, you have good days, you have bad days. It's not linear, you know, it's not straight up. You know, you're going up and down and to the left, to the right. And some days you're like, what have I done? You know, so, but luckily, you know, we've kind of hit our stride, and, you know, there hasn't been a whole lot of stress on that part. So I feel pretty lucky, but, I guess that's,
I love
very
that.
supportive.
I'm glad to hear it. I'm curious too. I'm like, go ahead. I want to hear your story, because I imagine it's like calling home and be like, hey, you know, that really good job that I had?
Yes, I know. I mean, I was always proud to work for, you know, such a great corporation, but I feel like there was a time where you just, you know, you're kind of, every day we would talk about, you know, I feel like we're meant for more than this. We need to pursue our own vision. And so, but I remember the day I walked out thinking, oh my goodness, what did I just do? Like I just left a steady paycheck, a pension, you know, I'm like, is this the right thing? But looking back, it was the best day of my life. I mean, I loved my patients, loved the doctor I worked for, but aside from that, you know, I get to now work with Kendall every day, and she was my preceptor. Now she's my best friend. We own a business together, and I just couldn't be more lucky to be able to walk in every day. You know, we go get coffee and work on things, and it's just such a great life. I love it. So I think that was the scariest moment, and also the best moment was leaving corporate.
I think that's what you want to lean on. It's just like the indicators are all showing yes. And that's,
we call it the universe.
Same.
We've been saying that for 12 months.
When I first met my wife, she kept bringing up like the universe, like, and it took me a while to like wrap my head around it and kind of get on board what she was trying to like, you know, kind of teach me and show me. And it really went along into our relationship too. And I was like, okay, I get it. It's like, I got to stop fighting it. Like, I got to stop like forcing my own will on it and just kind of go with the flow and just listen to what it's saying to me. So I've definitely grown to hear it more often than not. Of like, again, your gut too will tell you the same thing. And it's just the confidence of like knowing. I've kind of see where this is going. So again, I will go back into the healthcare system gap. You're essentially filling in a space that traditional healthcare systems have left empty. Do you see the recovery practice as a complement to that system or a challenger to it, or something else entirely different?
Can both be true?
Yeah.
I would say it's definitely a compliment.
Mm-hmm.
You know, I think the hospital system we worked for, they didn't offer it. You know, the nursing agencies that we could refer patients to, they didn't always just specialize in post-op. It was also senior care, you know, companion care, and then they would sprinkle in some there wasn't somebody that was just focused in post-op procedures.
Okay.
You know, so I think that it would definitely complement and benefit anybody's practice or hospital system that doesn't offer that.
Yeah.
Because if the patient has the choice, they should be able to make the choice,
Mm-hmm.
you know, of if they want to go home or if they want to go to an acute facility, if they want something through insurance or, you know, use us, you know, whatever it may be, they should be given that choice and
Absolutely.
option. I think the challenge is, you know, they didn't think of it first.
I love it. That's a great answer. I love it. Katie, for you, I mean, I'm kind of curious of your take of like, especially from someone who's, again, you're evolving too as a practitioner and just, again, being more on the research side. I'm kind of curious your take.
Yeah, I think it's a great supplement to current practices. I mean, we'll never replace an MD or a doctor's opinion, but I think there is something to be said about a nurse's knowledge and a nurse's scope of practice. And we, you know, always strive to align with that scope of practice, but there's so much that a nurse can do. And I think we also will benefit surgeons and doctors in a sense. So our goal is that, you know, we're taking care of their patients at home. And when a patient would typically call in and, you know, bombard, you know, the corporate system or the surgeon, we're trying to deflect that a little bit. You know, a lot of it is reassurance and education. They may forget their surgeon said, you know, weight bearing, whatever it may be. And then we're just there to re-educate. So I think it's really a great addition to the healthcare system. Yeah.
All right. I like it. You know, I'm kind of always about learning about the practice, but I also leave a little bit of time to learn you guys individually. And it's what I call like, just like we're talking so much and it's kind of now breaking down the walls. You guys know a little bit about me. So this is where I kind of get into the weeds with you guys. And I know you guys go on coffee dates together and that's a lot of fun, but I'm kind of curious outside of the practice, one, balance, how you guys work out or just try and like emotionally stability. I can't imagine kids, you know, teenagers and stuff like that. And then two, you know, this is just my take on like trash television. Like, what are you watching? It's like, are you more Grey's Anatomy or more The Pit? Like, that's kind of like what I'm curious about. So I'll let you guys answer individually.
I would say what I do to decompress is definitely just spending time, you know, with my husband and my kids. And that quality time was not something that I was able to get before, you know, to choose when I can decompress. And I think trash TV, Real Housewives, whatever city you're in, whatever season you're in, I'm there as soon as it's on. I would say I haven't watched Grey's Anatomy or The Pit.
That's totally fine. Yeah. I was just kind of gauging. You already brought up like whatever city.
But we have two big doodles, so I feel like we walk them every morning. They have to have like 2-mile walks.
Yeah.
You know, they're 70 pounds each. So we're up at 5 a.m. walking them. And, you know, I would say that's it. That's it for me.
Yeah, in my free time, I play tennis. So I'm actually
cool.
going to sectionals in August in
Nice.
Albuquerque. So I'm going with my mom. We're partners. So I play a lot of tennis, pickleball, try to stay as active as possible. And so I love doing that. And I don't know, I would say murder shows are our
Dateline for sure.
maybe not the most medical show.
That's the other thing. Is like I watched this. What was the funny bit? It's just this reel that popped up for me. It's like, why you can explain to me why women love murder shows about like getting murdered or like themselves getting murdered. They're like, no. We would love for it to be about men getting murdered, but there's not a lot of stories. I was like, oh, that's so funny. But again, thank you so much for you guys have broken down so much of this whole world of like outside care and what your patients go through. So I am very appreciative. I know that you guys don't get a lot of time to chat about it. And so it means a lot that you're divulging just as much as you can. So I'm now going to ask you like the final question is like, give us a little bit about the future of your practice. Is there anything big insights or goals, hefty goals that you guys have individually or as a practice together? Take it away.
Yeah. So I think one of our biggest goals is to expand and try and hire a couple of really great nurses to work with us.
Nice.
Our goal is to hire nurses, we say, that are better than us. So we're trying to be on the up and up there. And then we're really excited about trying to partner with a surgeon and travel overseas to try and donate some time. So a lot of surgeons will go and perform surgeries on underserved communities. And so our goal is to at least do one this year.
Great.
With them.
And I would say that we recently partnered with Anatomy Optimized, which is a physical therapy group. They're all doctorate level physical therapists.
Nice.
So we're developing packages together. So for those orthopedic patients, they can just get to our website, schedule their nurse, schedule their PT, and everything's at home. They, all the equipment, ice machines, whatever they may need, it's all just one-stop shop for them. So that was super exciting, to find that group. And we're just trying to make it as accessible and easy, for any patient that just wants to be at home. So I think we have lots of plans. We're partnered with a private chef to do prepared meals, so
great.
Patients coming from out of town or don't have someone to cook for them or, whatever it may be, they have that option where they can select meals and then get it delivered, we'll bring it to them. So
again, it's that thing of like, every little bit counts. And especially when it comes to recovery, it's like your nutrition is a big factor in that as well. So you are what you eat.
Low sodium. So we're trying to make it as easy where, we have the nursing part covered, but whatever else they may need, that we can offer that. So
of course. I love
exciting and coming soon.
Very, very exciting. So now I'll let Katie do this part. You can do the floor is yours to let everyone know where they can find you online, social media handles, any events you got coming up. The floor is yours.
Yeah. So we are TikTokers now.
Oh, nice.
Like 30 followers.
Great.
We're a big deal.
Hey, that's a start. Like again, I go back to it just takes one. You never know which one, and it's always out of the blue. Of like that's crazy that popped off, but it's like. You keep at it. That's a gold mine right there.
Yes. So, but we also have a Facebook, primarily our website, therecoverypractice.com, Instagram, all the social media.
Nice.
And
awesome.
Yeah.
I really do appreciate you guys coming on the show. Before everyone jumps off, you can hear every episode of our podcast at findingarizonapodcast.com. Social media handles Finding Arizona Podcast under everything. And last but not least, we say kisses, hugs, and belly rubs to our four-legged friends, and we will see you next time. Bye, y'all.
Thank you.